the landscape of treating patients with metastatic colorectal cancer specifically has expanded further with multiple new agents being approved, specifically in the refractory setting. And in fact, we have two agents that have recently made it to the market. One is Regorafenib, and then more recently an agent called TAS-102. Regorafenib is a biologic agent. It's a multi kinase targeted therapy, targets VEGF, FGF, and a number of other targets on the cancer cells. TAS-102 is more of a traditional chemotherapeutic agent, belongs to the overarching family of fluoropyrimidines. Both were looked at in studies that compared them to placebo in phase 3 studies in the refractory setting, very similar settings. The one difference is the TAS-102 study that came after the Regorafenib study included about 20% of patients who were previously exposed to Regorafenib before they received TAS-102. And so they're different. They both have improved outcome versus placebo and very similar magnitude of improvements. They've never been compared head to head, but historically at least they seem to be very similar. Their toxicity profiles are a little different. Regorafenib has toxicities that are more specific for its mode of action: hand and foot syndrome, diarrhea, hypertension. They occur usually in the first 15 days, and the worst toxicity that you see with these agents with this agent happens about 3 to 4 weeks into the treatment. After that, you figure out the dose, and typically patients that have those toxicities seem to clear them. For some, they have to discontinue the drug. The TAS-102 has more the traditional chemotherapeutic toxicities, such as neutropenia, also fatigue. More specifically, when you actually treat those patients for a little longer time, so again, as you see with chemotherapy.